Hello, dear listeners. This is your host Mugdha Kalra, welcoming you once again on the latest episode of our ongoing podcast series, Rainbows of Hope, brought to you by Rainbow Children's Hospital, India's leading chain of super specialty childcare with 16 hospitals spread across 6 cities in association with Earshot. In this unique series, we speak to some of the best pediatric specialists from across the country who tell us about their specialization, help us understand the complex health issues that unfortunately sometimes our children go through, and give us hope that all stays well with right and timely diagnosis and intervention. Our expert today for the fifth episode of our ongoing series is Dr. Shandip Kumar Sinha, who is a senior consultant, pediatric surgeon, and pediatric urologist at Madhukar Rainbow Children's Hospital, Malviya Nagar, Delhi. Welcome, Doctor.
Thank you for welcoming Mukta.
Dr. Shandip is an expert in minimally invasive pediatric surgeries and endoscopy surgeries. He is well versed and experienced in performing laparoscopic surgery for diseases like Hirschsprung disease, colorectal cyst, undescended testes, hernia, rectal prolapse, appendix, and gallbladder stones in children. An MBBS, MS, and MCH in pediatric surgery, Dr. Shandip was earlier a pediatric surgery professor at Maulana Azad Medical College, Delhi, and its associated hospitals. Let us tell all our listeners that Dr. Shandip is highly skilled in pediatric endourology, and he is also an author. His book titled Surgical Diseases of Children is widely discussed among the medical fraternity. In the first 4 episodes of Rainbows of Hope, we have discussed autism, blood disorders, cardiac complications in children, and neonatal care with experts from Rainbow Children's Hospital. Today, we are discussing pediatric surgery and pediatric urology, subjects not many are aware of. So, Dr. Shandip, let's start from there. How is pediatric surgery different from regular surgery, and therefore why must only a pediatric surgeon handle certain cases?
Well, a very good question to start with. You must understand that the pediatric surgeons are trained especially to deal with the surgical problems in children. See, the children, most of the surgical problems with children are different. Many times they are from birth or they are part and parcel of the development and growth and development of the child. So special knowledge, special training, a special understanding of these diseases are essential, and they're only taught to the pediatric surgeons, and that's why they are thought to be better manager. They are thought to manage these children in a better way in compared to the other specialties, the adult specialties. In fact, if you see the results of the procedure which is done by the pediatric surgeon, it is thought that the amount of time, the understanding, the results obviously will be better in compared to the adult specialities.
Interesting that you say that, Doctor, because a lot of parents do not even know that surgery and pediatric surgery are absolutely two different streams, and why must one go to a pediatric surgeon and not a regular surgeon in a hospital? Well, sir, what are some of the most common pediatric surgeries then?
We can have we can have pediatric surgery can be divided according to the age group. See, neonatal surgery, that means whenever a child is born, there are certain structural problems which can be there in the child from birth. You may have seen a children with a cleft lip in which the face part of the face has been cut in the midline, so-called cleft lip and palate. Apart from that, there are certain other diseases also. For example, a child may be born in which the food pipe is not there, and the food pipe is communicating with the trachea. We call it tracheoesophageal fistula. On the other extreme, the child may be born with absent anal opening, or may have some urological problem. The urinary system may not be normally formed, so-called anorectal malformations and the hypospadias. So they're extremes. Every part of the body during its formation can have certain problems, and they can manifest in the neonatal period at the time of birth. We pediatric surgeons identify that, diagnose them, and manage them in a proper way so that the child should have 100 years life without any problems. The other children, in older children, there are certain diseases which are peculiar. For example, so-called Mickel's disease, or there are certain diseases which are there because of the trauma, which obviously children can have. Again, we as a pediatric surgeons are managing it. Standard diseases like appendicitis, the gallstones, the hernia, hydrocele, etc., are again known to occur in children also, and we as a pediatric surgeons are managing it. So the whole spectrum of diseases are there, which can be there in the child. Certain diseases are peculiar to the children. Certain diseases which are common in the adult can also have a manifestation in children.
It is very, very difficult to imagine, doctor, that newborns may also require surgery. Your heart sort of sinks when you hear someone say that a little tiny baby may need a surgery. But how often does that happen, and how risky are these surgeries?
So if you see the hard data, 4% of the pregnancies, it means 4 children of the 100 newborns will have some form of surgical problems. So much common these are. Many of them can be minor, for example, hernias, or maybe, and it can go to the other extreme also, in which the child intestine or part of the body may not have formed normally. But they are known to happen. With growth and development of a country, the more the facilities, more the neonatal care, more the advancement in the medical science occurs, more and more commoner these diseases are, and better we as surgeons are able to identify and manage it.
Doctors' parents are very nervous around anesthesia and its role in pediatric surgeries. Where does that fear come from? And that leads also to the next question, which is about the minimally invasive surgeries. But first, I would want you to address this: is it a myth? Is it a legitimate fear? What role does anesthesia play in pediatric surgeries?
So very good and valid question. And to understand it, I will only like you to inform you that the major development in the neonatal and the pediatric surgery, which has happened in the last 10 to 15 years, has happened only because of the advancement in anesthesia. Nowadays, even 1 kg newborn can have anesthesia without any complications. Manpower is there, pediatric anesthetists are there who do take care of these. They're especially trained to give anesthesia to these small children. Then the industry has also supported us with manufacturing a small instrument, a small things required for this neonatal and the pediatric anesthesia. So whole manpower, industry, medicines have also become more safer and safer. And that's why, because of this advancement in the pediatric anesthesia, we are able to do major surgeries in the small children also. In fact, in our hospital where I'm working at present, we have pediatric anesthetists who train anesthetists also as a fellow to make them understand the intricacies of the pediatric anesthesia. And that's how we as a surgeons are able to deliver a better result. Coming to the minimally invasive surgery part, again, the role of anesthetist is there because we are using carbon dioxide in that. And again, the anesthetists take care of that aspect in a better way whenever we are doing the minimally invasive surgery in the children.
So, what are the different minimally invasive surgeries possible now? And because that is one hope that parents get, that all right, it will not be something which will put the child into a lot of distress.
So whole spectrum of neonatal surgeries, minimally invasive surgery are nowadays possible. In fact, every surgery of the abdomen and thorax, that is chest, can be done by the minimally invasive route. For example, common surgery, undescended testis, the child testis has not descended in a boy and had not come to the normal anatomical position, that is scrotum. Laparoscopy had come in a big way for the impalpable undescended testis. Apart from that, we are also doing hernia in a children in the laparoscopic way. Coming with the more advanced surgery, if you see the renal obstruction, pelvic aortic junction obstruction, a very common problem in the childhood. Again, laparoscopic pyeloplasty, minimally invasive pyeloplasty we are doing. So there are lots of procedures which can be done by the minimally invasive way. In fact, thoracoscopic repair of the tracheal fistula also we are doing in our setup. But the point is that we must understand that the advantages of minimally invasive surgery in the children are more in compared to the adult. For example, 50-year-old person like me, if a open cholecystectomy or open surgery is there, I will have to live with my scar for the next 30, 40 years only because the human life is maximum 100 years. On the other hand, if you're doing in a newborn, a surgery is being done, the child, because of the scar, will be remembering his surgery for lifelong. And that's why it is essential for us to take care of the psychological aspect, emotional aspect of the unit. We try to give smaller scar. In fact, no scar many times is there. Children do not see that every day, do not remember that some abnormality was there, and they develop in a more emotional, better way in compared to a child with a scar. The other advantage for us as a surgeon is that because of the camera magnification, many times we are able to do finer surgery because children's structures are as smaller. So magnification offered by the camera, the laparoscope, etc., helps us in doing the surgery in a better way in compared to an open surgery.
Doctor, that must also mean that a specialized department then becomes very important under one roof. What kind of tech support and med support do you need for following the protocols and also for performing these surgeries with the absolute finesse?
Well, you have to understand that the industry has supported us in a big way. In fact, if you see the car stores, the companies who manufacture these pediatric instruments, nowadays they are manufacturing even 3 mm or 2 mm final instruments for the children. This has only happened because now it has become financially viable too. So, provide an instrument, it has to be financially viable. And the companies all over the world, with the advent of minimally invasive surgery, more and more of the surgeons are doing this. Obviously, the industry is also supporting us. Apart from that, for caring, it is not that human resources are not important. You need good neonatal intensive care unit. You need good pediatric intensive care unit to take care, apart from the pediatric anesthesis, to take care of these children in the post-operative manner. And that's where in the institute like me, where I am working, we have good support of the neonatal intensive care unit. We have very good support of the pediatric intensive care unit. And that's how after major surgery, 3, 4, 5 hours major surgery, we are able to take care of these children in a better way. In fact, most of these children, in spite of the major surgeries, were able to discharge in day 2 or day 3 because of the support we are getting in this hospital or the infrastructure which has developed in the pediatric hospitals all over the India and all over the world also.
Wonderful, sir. I also hear a lot of patients come from outside of India. What are these surgeries they come for?
Well, this is a major success story after the software. You have to understand that the Indian doctors, because of their training, because of the knowledge, are thought to be very good, skillful doctor, and that's why many of the children with the diseases which they are not able to manage in their country or because they need advanced surgical care come to us. I can guarantee you that with the progress which we are having, the next few years, India will be a major, obviously it is still it. India is a major hub for the medical tourism. Now coming to the children, it is again a spectrum. Starting from the hypospadias in which the urinary orifice is not formed, so-called extrophy, these are rare diseases, to a child who has taken acid by mistake and is not able to take feed for years. Those are the specific group of children who come to us for the surgical intervention, and we are happy to inform you that we are taking care of these children in a very good manner, and then they are going back to our country with a success story, and the quality of the life of the children also improves. Apart from giving a good name to us as a surgeon or good name to our country, India, because of the skills and the infrastructure, etc., which is available in our part of the world.
Doctor, my next question is related with the urology. And what are some of the symptoms that need a urologist, a pediatric urologist's intervention? And how does a parent know that now a pediatric neurologist needs to be consulted?
Again, nowadays with the antenatal scan, see, during pregnancy, you must have seen that most of the pregnant females are getting 20 weeks scan. Scan is the scan at which most of the urological problems are identified, and this is the time from which the pediatric urological consultation is important because depending upon the size, depending upon the parameters which we have developed with the Society of Pediatrology, we want to predict which of these children will need some form of intervention in the postnatal life. Apart from the antenatal, in the postnatal period, whenever a newborn is having difficulty in passage of urine, or if in a boy urinary stream is not normal, That is the time at which we must consult a pediatric urologist, because that is a very important part of the development of the renal system of the child. Simple concept: during the first 2 years of life, the renal system of the kidneys are in the development phase. And if there is some obstruction and this, or if there is some problem, because of which the child renal system will not function properly and the kidney will fail at age of 20, 30, 40 years. On the other hand, if you do proper intervention at appropriate time, that kidney will function for 100 years. This is the advantage. This is the beauty of intervention at appropriate time. And we as a pediatric surgeons always guide the parent that you must consult us. We do not need HIFI investigation. We need certain ultrasound, urine, basic urine investigation. And depending upon that, if there is some problem in the children, we do take care. We have advanced cystoscopes, very fine cystoscope, which can enter the urethra of a neonate also, 2.3, 2.5 kg children also. And that's why appropriate intervention at appropriate time is a very important aspect of the pediatric urological children or neonate with pediatric urological problems.
Great, doctor. My last question to you, sir, is any word of advice that you would want to give to the parents who are listening to the show? What are some of the symptoms that one needs to look out for and are easily missed during the early adolescence or when the child is young? What are some of the most common symptoms that parents miss and they should be careful about?
Well, one of the important advice of the parent is that take advantage of advancement in the medical science. Do not worry, because now we are at a stage. The beauty of the medical science is that we are at a stage that most of the problem we are able to sort out in the children with a very good long-term result. Even malignancy can be taken care of without any problem. Number two, take help from the Google, but in an appropriate manner. See, there are certain websites which are available, which are government websites, which give you authentic information. Although Google algorithm always tries to direct you to that site, but try to get authentic information and be wizened. You have read, you have graduated, you have given your class 10th, class 12th exam, etc. Those examinations are only there to prepare you for this eventuality, because if unfortunately some of these problems are there in your children, try to use internet in a proper way so that appropriate information, appropriate knowledge you have as a parent, and then you can take intervention. We have seen that in spite of being educated, the parent go to homeopathic or other form of medicine, even in the obstructive renal pathology, and then the precious first 2 years of life is lost, and then the renal recovery potential of a child is gone. So do not make those mistakes. Nowadays, information is everywhere. Our role as a clinician is to direct you to those information. Your role as a parent is to understand and take proper information and act accordingly. Now, coming to the problems of newborn, the how to identify these problems. Obviously, as I have told you, antenatal scans will pick up most of these problems. So try to have knowledge, try to understand if there is some problem in the antenatal scans, try to remember that and show to a surgeon in the postnatal period. What happens that whenever a newborn is there, because of the happiness and many things, many of the time the renal anomalies which was picked in the antenatal scans are missed by the parents, and then at the age of 2 years, suddenly it is known that, oh, it was there in the antenatal scan, but proper intervention was not there.
Right.
Number two, in the latter part of the life, obviously, routine physical examination before going to the school, during vaccination is integral part. Every pediatrician does that. Many of the surgical problems are picked up during those routine clinical examination in the slightly older children. So always do that. Dental hygiene, etc., school health checkup, etc. Those are the time at which many times the routine surgical problems in the children are picked up.
Well, thank you so much, Dr. Shandip, for that insightful conversation and your time. Thank you so much.
Thank you. Thank you.
Well, that's it for now in the 5th episode of Rainbows of Hope. Parents and near and dear ones of young hearts listening to our podcast, remember we have got Rainbow 1 for complex and critical cases. For any such cases in children, visit rainbowhospitals.in or call at 8882 281 281. We'll be back soon with our next interesting episode. Stay tuned to Earshot on www.earshot.in. You can download the Earshot app from the Google Play Store. Our podcasts are also available on Spotify, Google Podcast, JioSaavn, Apple Podcast and Gaana. Stay happy, healthy and always hopeful. Bye-bye for now.